Hi, everyone. Okay, we'll go ahead and begin the webinar now. I think that there aren't many people waiting in the waiting room anymore. So you're very welcome to the Irish Consortium on Gender-Based Violence's webinar on ensuring girls' protection, education free of gender-based violence during COVID-19. So we'll begin the webinar now, and I would ask that for the moment, everyone keep your microphone on mute, but you're welcome to keep your video on so that we can see your faces. And at this time, I'll pass over to Siobhán McGee, Chair of the Irish Consortium and CEO of ActionAid, for a few opening remarks before we begin. Over to you, Siobhán.
Thanks very much, Brianna. Good morning or good afternoon, depending on where you are. Excuse me, everybody. It's great to see people signing in and to see where you're from, different parts of the world. You're very welcome to the webinar. It's hosted by the Irish Consortium on Gender-Based Violence. I'm Siobhán McGee, and the chair of the consortium at the moment, and the CEO of ActionAid Ireland. As you probably know, and as most of us did, when the coronavirus pandemic hit, the consortium pivoted our learning events to online. Obviously, it's a really challenging time for members and those we engage with, but it's also just as important or more important to come together, learn from each other at this time. And we really have been blown away by the amount of people who've joined our events and from across the globe. So thank you for being here today. And perhaps one of the dividends of moving online is the way that we can engage more widely than we might have before, which is something to learn on or reflect on in itself. So the context for this webinar is that in March, the consortium had prepared and shared a learning brief on school-related gender-based violence. Intended at the time around the Commission on the Status of Women, and we know that was significantly curtailed and scaled back. The paper was launched anyway and shared on the website, but we didn't have the opportunity until now to have a wider discussion on school-related GBV, which is what the intention of the work we do here today is. So obviously, most of you know, because we're working in this area, that the impact of the coronavirus pandemic has had a huge impact on education, closing schools immediately, and many still closed. And within that, having children, young people out of school, girls are disproportionately affected. And our work on gender equality effectively, mostly came to a halt. So that's very significant for us and all of us that are working in this area. The UNESCO estimate that 10 million secondary school going aged girls are out of school or were out of school. And it's a huge concern that girls will be able to resume their education, especially given the kind of context and the pressures that are on families and poverty. And we have seen the onset of early marriage, the numbers of that going in the wrong direction again. So these are some of the challenges that we're working with, I guess, at the moment. And whether girls and boys are accessing education in school or remotely. I think the point of what the seminar intends to focus on today is what are the protection concerns in light of that? What are the new concerns that have emerged in this context? And how can we strategize on how to address those and how to build back better and to ensure to the best of our ability that schools have the services and interventions to prevent GBV, respond to GBV. So looking forward to hearing from the panelists, the esteemed panelists, and then from yourselves as participants on how we're responding through programming, advocacy and policy work at the moment to keep all children safe from GBV. So I can stay for not the entire webinar, but I'll be here for quite a while. I look forward to hearing the discussions and to following up later in terms of the outcomes or points that we would follow up on. So Brianna, hand back to yourself to hand over to the panelists, and thank you to the panelists for making your time available for sharing your knowledge and your insights today. Thanks, Brianna.
Thanks very much, Siobhán. And thank you as well. I forgot to introduce myself. I'm Brianna. I'm with the Irish Consortium, and I'm the Communications and Policy Officer. Abby Ryan, the coordinator of the consortium, is also on the call, and she's going to be managing some of the chat in the chat box. So thanks, Abby. Again, it's great to see so many people calling from around the world. A few housekeeping points before we begin. I'd like to ask you to all keep your microphone on mute so that we can all hear the panelists clearly, but you are very welcome to keep your video on so that we can see your faces. I think it's, in this time when a lot of us are working from home, it's nice to see as many different people as we can. And again, we are going to do a question and answer with the panelists, and we really like this to be a kind of engaging, interactive session. So please, as we discuss with the panelists, feel free to post questions in the chat box as you have them, or indeed you can also raise your hand using the function at the bottom of your screen. So again, Abby will be kind of managing the chats, and we will try to get to your questions as soon as we can. So without further ado, I would like to introduce our panelists for today. First, I will introduce Tien Nguyen. I don't know if you want to give a little hello, Tien. And then I will just, let's see if I can, I'll go ahead and read your bio. Tien is a Youth Advisory Committee member with Plan International in Vietnam, and she has been interested in gender equality since university. Her first experience putting this into action was when she worked with UN Women when she supported various activities promoting gender equality. In addition to her current work with Plan, she is a mentor with the Monochrome Project, which was founded to raise awareness of gender equality issues. And she also works in the renewable energy industry, and she is active in the Women in Renewable Energy Forum. So we're delighted to have you, Tien. Thank you for joining us. We also are joined by Agnes Kola, who is the National Coordinator of Women's Rights at ActionAid International Kenya. Agnes has worked for 13 years in various roles with ActionAid Kenya, including Program Coordinator and Program Manager. She is a community development expert with skills across program design, implementation, policy analysis, monitoring, and evaluation. In her current role, she leads and manages women's rights programs aimed at building the capacity of women and girls from communities living in poverty and exclusion. Agnes has years of experience in establishing and strengthening women's rights organizations, networks, and movements that are on the front lines of fighting all forms of violence against women and girls. Thanks so much for joining us, Agnes. And last but not least, we are also joined by Amy Folan, who is Senior Education Advisor with Concern Worldwide and based in the Dublin office. Amy supports Concern's education programs across Asia, Africa, and the Middle East. Before being based in her current role, she was Education Coordinator with Concern in Sierra Leone from 2014 to 2016, supporting the education program transition to education and emergencies during the Ebola crisis and through post-crisis recovery. In total, Amy has been working in education for over 15 years, 5 years as an early grades primary school teacher in Australia and Asia, and 10 years working with a range of INGOs. Amy is also a member of the Global Working Group to End SRGBV and the Interagency Network for Education and Emergencies Gender Task Team. So thank you very much, Amy, for joining us as well. So all panelists are very welcome. It goes without saying that we have a lot of expertise in the room. We're delighted that they could join us. I think that will lend us a very interesting conversation today. So without further ado, I think we can jump into the discussion. But before we begin, I think we're all very cognizant that the education context varies quite a bit across the globe. So and our panelists indeed are working in different areas. So I would ask each panelist first if you could briefly describe for our audience what is happening within the primary secondary education system in the context that you're working in. For example, are schools back in session? Are they working remotely? So Tien, could I ask you to respond first, please?
Yeah, sure. Yes. Yeah. I would like to introduce again. My name is Tien, and I'm a member of Youth Advisory Committee of Plan International Vietnam. And so I think I will bring up here the phenomenon of film stalkers in Vietnam, because students back to school after a pandemic. So there are several cases of film stalker in school, especially in secondary school. And all of these cases were boys sneaking on girls. And actually this situation is already happened before the pandemic, but it's just like really rarely, since they haven't seen each other for a really long time and get back to school. So many cases of sneaking at school were caught, increasing. And students who are you know that students who are in poverty have a certain curiosity about gender, about sex, about physical state, and nobody showed them the right way to approach those knowledge or deal with their curiosity. So there are a lot of like victims of film stalkers, and you can see like for girls like who will really feel bad because like they afraid of their photos, their videos could be public somewhere and being in a discussion with a group of people. And with that mentality, like they don't dare to speak up for and tell anyone about their situation. And for boys, like if they were caught because of their bad behavior, they will got disposed, and it's affected really negatively on their own future. And you can see like specifically like they will close the door for them to approach the college or university. And because like in Vietnam right now there is no like we don't have any regular for that kind of behavior. So when somebody speak up or when some case caught, there is no they don't really solve the problem. So that's why like people try to hide it more than show that it and resolve. Yeah.
Thanks so much, Tien. I think that example of film stalkers in school is a real, a very specific and jarring example of a type of school-related gender-based violence that it seems that girls in Vietnam are facing. And I think that really starts this webinar off on a strong point of such a serious example of the gravity of the issue that we're talking about, and something that really, even if girls have access to school, that really is a barrier in the quality of the education that they can receive. And can you just so we'll definitely talk more about that. Can you just clarify for the audience, so school is in session in Vietnam at the moment?
Yeah, actually, like Vietnam is quite safe for COVID-19 right now. So we already like back to school on in September, like start of September. So everybody is already go back to school and
Okay.
go back to working.
Thank you very much. And again, we'll talk more about that in a bit. And now, Agnes, could I get you to just briefly describe in Kenya the situation with primary and secondary education at the moment, just to give our audience a bit of context. Over to you, Agnes.
Okay. Thank you everyone, and nice to meet you. I bring you greetings from Kenya. The situation in Kenya is that when COVID set in towards the end of March, schools were closed at that point, and up to now, schools have not reopened. We had a presidential directive on 28th of September, that was just on Monday. And what the president said is that the schools should remain closed until further notice, because there is not adequate preparations that have been put in place to allow children to go back to school. So both primary and secondary schools are still closed, though the Ministry of Education has been charged with adhering to protocols. There are protocols that have been set up for reopening schools, so they have to adhere to those protocols before children get into school. Institutions of higher learning, though, are opening gradually, with the final year students reporting from Monday. One of the issues that schools are facing, especially the secondary schools, is that a number of them were used as quarantine centers. So then for them to even reopen, there has to be adequate fumigation that happens. They have to be able to build the level of confidence for parents to allow their children to go back. So right now, we are still not in session, but we foresee that within the month of October, possibly, if all the requirements are met, the Ministry of Health requirements, then we could see children going back to school. So that's the situation in Kenya. In terms of COVID, our cases are close to 40,000 confirmed cases and about 700 deaths. So it's not as the impact is not as big as it is in other countries, but it's something that is worth taking precaution around. Thank you.
Thanks so much, and we'll definitely get into talking later about the challenges of that of remote education as well. And I think you'll have some really interesting insights for us, Agnes. And Amy, I'll pass over to you. I understand, Amy, that you're working in various contexts, so I'll let you share with us whatever you would like to on this note.
Great, thanks. So yeah, currently Concern is implementing education programs across about 12 countries in both the development and humanitarian context. By April, all schools in all of our programs were closed, and the majority of them remain closed. There's been attempts at continued learning in most of the countries that we're working in, but we've done some light touch research to look at how accessible that is to the children in the families that we work with. And the majority of the poorest and most vulnerable families aren't able to access the continued learning that's on offer. A lot of the time that's because it is really heavily reliant on technology, and the infrastructure just simply doesn't exist for those hardest to reach communities. So even though most countries will say that there's continued learning opportunities, it's not reaching a large portion of children. We have some countries of operation that opened for brief periods of time for children to be able to sit exams. So for example, in Niger and Sierra Leone, some children had access in primary and secondary school. With the rains, they've reclosed, and there are plans to reopen, but it's a little bit questionable as to when that will be. And of the 12 countries that we are working in at the moment, most would have some form of plan to reopen. Some have had plans to reopen in September and they remain closed. So it's not clear as to what's happening, and I think there's definitely confusion with communities and teachers as to what is expected across many different contexts. But then we also have some countries, for example, Chad, where there isn't a clear plan as to when schools would reopen, and it's looking as though children will miss at least a full academic year because of the closures. So it's quite a varied situation across all our programs, but essentially huge impacts in terms of closure and very little impact in terms of being able to access continued learning.
Thanks so much, Amy, and thanks for putting into that context that kind of serious issue we're dealing with of so many children globally being out of school. And I think, as we all know, we're really having this conversation in the midst of it all, not knowing what a lot of impacts into the future will be. And so Agnes and Amy, you both mentioned that in many contexts, schools are operating remotely, and we know that this can come with some challenges. So I'm wondering, what are the protection risks that this presents, and how can we address them in programs, or how have you adapted? So Agnes, I'll pass over to you.
Thank you. In terms of remote learning, the reality in Kenya is that most of the children have been unable to access remote learning, and this has to do with their inability to have the right kind of gadgets, or to be able even to have internet facilities and things like that. So when we talk about remote learning in Kenya, it's been used for a few children who are mostly well off, who are able to have classes remotely. So the bulk of children in Kenya have not had any learning from March. So possibly they could be reading a few books here and there, but in terms of guided education and learning, this has not happened. So of course, there are many issues that are presented by just being at home for about 6 months or so. What we are seeing is that there is a huge increase in sexual and physical violence within households, and this also links to issues like unpaid care work, because we know that many times, especially girls who are a bit teenagers and maybe preteen girls, are also given the burden to support their mothers at home. So there is the risk of increased chores that they have to attend to. There is also the risk of increased sexual and physical violence. In Kenya, we had a report where there was an upsurge of FGM in the FGM practicing areas. And it could be because possibly parents are looking at this period as a period when they can quickly get their girls to go through FGM and then get married off. But even apart from FGM, we've seen an escalation of teenage pregnancies that have happened across board. So what it means is that there is a risk of increased sexual activity for these children as they continue to stay at home. And even as we come towards the end of COVID, we know that there will be a huge chunk of children who may not be able to re-enter school. So there's a huge risk in not just in terms of dropping out, but even the gains that we had made earlier around enabling children to get to school and benefit and get quality education. These gains may be eroded because of the huge gap that has been there around the education sector. So those are some of the issues that we are facing. And in terms of response, as ActionAid, we have had to do a lot of programming that then speaks to the situation that the children are in, especially the girls, because they seem to be hit much more than the boys. And one of the things that we've done is to be able to change our programming, either stop doing some components of work or adapt and change some components of work to suit the situation as it is, or introduce new components of work that are COVID related. So this could be issues that help people to be able to understand what is COVID, how can you be able to maintain hygiene and things like that, so you don't get infected, but at the same time, you're able to be productive around this period. So some of the initiatives that we are doing right now, say having more home visits, as opposed to centrally reaching children in schools, we are reaching them at the household level. We have some initiatives like phone mentorship sessions that we are doing with the girls. So the patrons or the mentors who ideally would be reaching them within the school environment are now talking to them on phone and keeping communication lines open to enable us to be able to address those issues. And of course, we have increased our vigilance a lot. Vigilance in terms of monitoring what are the issues around sexual and gender-based violence, how should these issues be addressed. And one of the ways in which we have has really helped us a lot is an SMS platform, which is a means that girls can be able to report any incident of violence that they are facing, or they could even report an issue that they have seen happening to somebody else. And it's a private way of reporting, and it ensures that there is some follow-up mechanism that can address those issues. So there are a number of initiatives that we are looking at that have helped us to be able to cope during this period. Thank you.
Thanks so much, Agnes. That's really interesting to hear about the program adaptations and moving to the home kind of level, because we know that schools are often the first point of contact for girls who may experience violence in the home. And so when they're not in school physically, that you have to go to them with ActionAid. So that's great to hear that. Thank you very much. And Amy, I might pass over to you and ask you, I know that in Sierra Leone and potentially a number of other countries, Concern had SRGBV education programs. It was a real component of the programs. So I'm wondering, how were your programs impacted, and maybe what are the current, how is the program impacted, or how are you kind of looking forward to the future of reopening schools?
Yeah, thanks, Brianna. As you mentioned, we integrate and embed SRGBV prevention and response actually into all of our education programs. And it's one of the key components of our wellbeing aspects of our work. So obviously with the closure of schools, there was a lot of shifting that was needed. But as Agnes said, really that focus on the community and the family has been really key. All of our programs originally focus on the socio-ecological model, so we don't just look at the school as the source of SRGBV and looking at that area, but we look outside the school and how the gender-based violence and gender dynamics within the community and the family impact on girls and boys' ability to access education and learn effectively, and to stay safe. So really with the current crisis, our programs have been able to put more emphasis on that engagement with caregivers as the primary educators of their children now. So it's been a nice opportunity actually for us to really focus in on that and make sure that our programming is really taking a transformative approach within the family and community that can then be rolled into our plans as schools reopen. So making sure that our plans for reopening embed that process of transformative engagement with teachers and school administration into the training that's going to happen to prepare teachers for the reopening of schools. Also looking at engaging with ministries of education and that sort of higher level engagement around policy, as well as the general practicalities of how to get some of these policies really off the ground. So looking at making sure that with the continued learning that's on offer, that we are able to highlight the importance of the protection and safeguarding of children. So when we're engaging teachers in small group activities at the community level, that prevention side of things is very strong, and also having, as Agnes mentioned, opportunities for children to know how to report and how to stay protected. The last one I would say is really looking at how we can make sure that in all circumstances, so whether that's a development situation where SRGBV is quite, I suppose, common factor in education programming, but also looking at our humanitarian side where we might not have always prioritised SRGBV as such. So for example, in Northeast Syria, when our education programs had to close, our non-formal learning centres weren't able to be open, we shifted to engaging the caregivers and made sure that within what would normally be a social emotional learning component, we really embedded that transformative approach with the caregivers to then take through with their children. And that is mirrored then as the centres are slowly reopening. So I suppose in some ways it's been more just a focusing on the certain aspects of the socio-ecological model that we can access, and making sure that we have in place the plans to be able to broaden that out once we have access to the schools.
Thanks so much, Amy. I think that really, a lot of that got it. So kind of the number of components that are involved in schools, the role of parents and not only just schools, but yeah, parents and teachers and teacher training, etc. So we've had a question come in from the audience that I think I'd like to ask. So someone asked, do any of the speakers have experience with successful, effective engagement of high-level leadership within ministries of general education to prioritize prevention and response to school-related gender-based violence, whether during COVID or prior? And I might give Tien a moment to talk about plans work in our paper. And then I'll come back to Amy and Agnes, and maybe you can chime in. In the report that the consortium did, there was a case study from Plan that talked about counselling that is present in schools where Plan was working, and there was some uptake of this by the education system. So Tien, I might hand over to you if you want to say anything about that.
Yeah. I would like to talk like how we have engagement with the Ministry of General Education, and for Vietnam we have Ministry of Education and Training. So for Plan International Vietnam and for us like Youth Advisory Committee, so we start every project with a small scale. So it's mean like we will start partnership with each school or each area that we want to work on, and especially in Vietnam right now we focus on ethnic group, and we will have a kind of like project model, and we will do trial in that area, and the output, the result, we will have a report to talk with the Ministry of Education and Training and how to scale it up. Because like actually like if we just show them the model, if we just show them the plan, maybe like they won't like believe in the impact that we can do. But actually like for us, like if we show them the really result, like how many percentage of girls like they start focus on studying, except that quitting or kind of like prevent girls from early marriage. So those kind of number will show the ministry that we are doing the good things and scale up with the district level or city level. And first, like we focus on the mountainous province, and I can show you some impressive numbers that we achieved in several years. So we already like approached like 50,000, like over 50,000 parents, and convince them for like to allow girls to go to school. And we host like over 13,000 classroom session about gender inequality. Sorry, it's gender equality. And we deliver over 25,000 girls increase knowledge on gender equality. Like they know about their rights, they know about their like how to protect themselves, and set up a school-based counseling service. And we try to reach like one by one case, and it's already reached like 4,000 girls and seeking for help. So we try to like solve the personal problem, then making the really big impact. Like for the mass media, like mass area, we will do kind of like raising awareness, but we still try to like solve the problem one by one, personal for each girls that we try to help. And we also involve boys into the activities to raise awareness about gender equality. We training teacher and students to raise their awareness and reduce the discrimination in school. And right now, like we can say like from the beginning we just have like 20 school in the plan partnership, but right now we already have like 1,500 school in in several province, and we have like 50 schools in the really kind of like mountainous province with the ethnic group. And we reach like over 60,000 girls and boys in the ethnic minorities. Yeah.
That
You're
was
on
amazing.
mute.
Thank you. Thanks, Tien. Thank you so much for those additional examples. And I would welcome anyone who wanted to see a plan specific case study on plan scaling up counseling around and gender responsive schools model, scaling that up in secondary schools in Vietnam. And I invite you to take a look at our learning brief online. I'll just give Agnes and Amy a chance if they want to talk about any examples of successful, effective engagement of high-level leadership within ministries. Agnes, I know that you're working really at a national level around women's rights. So I don't want to put you on the spot, but if you have any specific examples of kind of success of working at that high level regarding school-related gender-based violence, it would be great to hear from you.
Yes, thank you. I can share briefly. One of the projects that we are implementing in ActionAid Kenya is called the Education for Life project. And this project is funded by DFID, the Girls Education Challenge, Leave No Girl Behind portfolio. So one of the things that the project has enabled us to do is to have in place a national project steering committee. Now, this committee brings together all the actors at the national level, and their directors of education, those who are handling issues of special needs, those within the technical and vocational training sphere. So it gives us an opportunity to be able to, at the highest possible level, to be able to influence in terms of policy directions that are happening at that level, but also as an accountability tool. So we can be able to hold them accountable in delivery of some of the things that they are supposed to do around education. One of the policies that we are working through with them is how to actualize the return to school policy for girls who drop out, either because of pregnancy or getting married. Are they, the opportunity for them to be able to go back to school and enjoy quality education. Beyond the national level, we have a structure at the county level. In Kenya, we have counties that are more or less like districts. So there we have the county steering committee that would then have education-related officials at that level serving the same role. And within the school community, then we have the school management boards. So these are all areas that we can be able to use to influence issues of prevention, issues of response, or to bring in any agenda that we feel would be able to help the girls to stay in school and be more productive. So those structures are there, and maybe offline we could still talk more about some of the issues that are coming out of that engagement. Thank you.
And Amy, I might pass over to you to see if you have any comments. And actually, when additionally, when Agnes was speaking about the issue of pregnancy and often a ban on allowing pregnant girls to go back to school, that made me that kind of already got at one of the questions I had from you, which is about the overturn of that ban in Sierra Leone. So perhaps you want to chat a bit about that.
Yeah, so I suppose there's two things that I could mention here as well. So in Sierra Leone, our program we're implementing an ActionAid funded safe learning model, and we're midway through a large scale RCT with our research partner, UCD School of Education. We're looking at the impacts of systematically addressing SRGBV on child wellbeing and learning outcomes. And prior to the closures of schools, we were getting a lot of traction with the ministry related to comprehensive safety and protection policies within the Ministry of Education. And so during the crisis, the ministry is taking the opportunity to look at education policies as a whole, and there's opportunities to really take some of that research and the findings from that to embed into those policies and supporting implementation guidelines, which is a fantastic opportunity. And it builds on the issue around teenage pregnancy, because part of the reason that the minister is very keen to look at these comprehensive safety and protection policies is because of the situation that sort of occurred during over the last few years in Sierra Leone. The Ebola crisis in Sierra Leone really brought to the forefront the issue of early pregnancies and underage pregnancies. But it's important to note that it wasn't a new situation in Sierra Leone. It was prior to the crisis, the Ebola crisis and the current crisis. It has been a big issue in Sierra Leone. And there's always been a lot of rhetoric around placing blame on the girls and the responsibility on the girls. And so there was a lot of concern raised during the Ebola crisis when the then ministry reinstated or reinforced existing bans on pregnant girls being able to access education or sit exams. And that created quite a lot of negative energy around on both sides, actually, in terms of people being very pro that ban staying in place, and then obviously some of the international attention around overturning that ban. So when just prior to school closures in about March, I think it was, the new minister overturned that and put in place new policy statements around the importance of pregnant girls or girls who have just given birth being able to access education and at a high quality level. And so in order to support that, there's this big strong focus on the protection side of children, and shifting away from placing the blame and responsibility just on girls and looking at how we actually keep children safe, both in the school and outside and around the schools. So it's been a really sort of, I suppose, coming together of all the pieces with the research and the impact that we're seeing with what's happening with that, and then the overturning of this ban, and then with the school closures, again, that attention being brought to the increased vulnerabilities and the increased potential risks that girls face in terms of early pregnancies, but really trying to shift away from the focus just being on that pregnancy and looking at how do we actually prevent the violence and violations that are happening to actually prevent that from being the issue.
Thanks so much, Amy. Yeah, I think that it really gets at the deep level of stigma, I think, around a lot of these issues. And that reminds me, even I'm thinking of the connection back to Tien talking about the film Stalkers and how there's stigma in Vietnam. There would be stigma to this experience, and I know that girls and women have difficulty in speaking out, and it also evokes questions around the Me Too movement. So I think we see the stigma kind of manifesting in different ways depending on context. So I want to just pull Tien back into the conversation, and I wanted to ask you, Tien, what do you think are the barriers and attitudes in society that make it difficult for us to have these conversations about gender-based violence, or about whether or girls being blocked from going to school for various reasons, or about the violence that girls might experience in school?
Yeah, so I think like thanks for your question. I think like the barriers of my society, like in Vietnam, is the same, is a common things in Asia as well, like because of the culture. So it's really kind of like embarrassed or shy for us to talking about gender, talking about sex education. So it's mean like when girls or boys, like they grow up in the family, so their parents will have a really bad talk. For example, like if they ask like, hey mom, where I came from, like where I was born, so the mom will answer like from neck, or that kind of really bad talk, right? So it's really hard for children can approach the right knowledge about sex education. So they lack of information, and because like we don't really take gender education or sex education in account at school. And it's kind of paradox things, because like nowadays like parents encourage school to deliver gender or sex session in school, but when it deliver for children and they sense it quite sensitive, they will argue with school, and they will do a lot of things like against it. And it like we still have to let people know that like sex education or gender education is the right of every children to approach it. And like right now, I think like the barriers and the attitude is just only focus on the knowledge and the awareness about the importance of sex education in school and sex education for children. I mean, like it's not just about a physical statement, or it's not just about the knowledge about their health. It's also about the knowledge about their right, like how they can protect themselves if they have harassment or anything that harm their self. And like by now in Vietnam, we try to change these barriers, like because like we cannot do it official in school. So that's why like we try to do it like an official way, and more like and much easier to approach kids by social media. And we try to change the way to talk to kids. Like for example, like if the teacher or the parents quite shy when sharing those problems with children, we will try to change the people who approach the children same as us, like teenager. So that's why like we have kind of like youth advisory committee to approach another way with those kids, and make the knowledge and make the information more kind of like familiar with them. For example, like we try to write a song, we try to make a lot of like festival to engage people and acknowledge about their rights. And we have some kind of section about like we have square and circle, and somebody have power, and let them discuss in some section like that. So we make it more fun and more sharing, and being really interactive with children.
Yeah, thanks so much, Tien, for highlighting, I think, the really important role of sexual and reproductive health and education in this conversation, the importance of that, but the difficulty really that I think a lot of education systems truly globally have in addressing this issue and incorporating this into schools. So it's really interesting to hear some of your insights. I'm really blown away by the questions that we're having. So I'm going to try to get back to some of the questions that we've seen in the chat. One of them gets at a question I wanted to ask too. So someone said, a question for Agnes, the SMS platform introduced during COVID-19 that you mentioned, how accessible is it for girls from vulnerable families who might not have access to gadgets, they said, or to technology? And indeed, I was also wondering, how do we make sure that we're reaching the girls who might be most disadvantaged, maybe girls with disabilities or girls in rural areas or from minority groups? So over to you, Agnes.
Yes, thank you. The SMS platform was not established because of COVID. It's a platform that we've had for 4 years now, and we use it for monitoring and reporting any incidents of violence, but we also use it for information dissemination. Through bulk SMS, we're able to send information or announcements of what is happening within certain communities, and people are then able to access the service. So during COVID, it has become very instrumental because it has given an opportunity to bring a new kind of reporting that is, yes, it could be sexual and gender-based violence, but it is also COVID related because, you know, COVID up some of these cases that again are directly linked to issues of sexual and gender-based violence. We are able to link those issues up to where they can get support. So in terms of privacy, it's a very powerful tool because the reporting can happen in private. And the good thing is that 75% of Kenyans have phones, and we know children do not have phones. But what happens is that the reports can be made through, you know, the phone of a sibling or a parent or any other trusted adult that is there within those communities. So it is not the only way that girls and children can be able to make reports on what's happening. There are walk-ins that can also happen because in each of the areas where we work, we have women rights network members and movements that address issues of sexual and gender-based violence, and they link them to the government reporting mechanism. So it's this one approach that can work for those who are able to have access. And fortunately, we are seeing that many people actually have access to mobile phones and they're able to make reports. The good thing about the system is that it generates a lot of data that is useful for decision making and planning. One of the challenges that we have in our country, even from the government perspective, is getting information that is related to some of the issues we talk about. So on a monthly basis, we are able to generate reports and we are able to link it even with the government priorities because the SMS platform is linked to a GRPS map. So you can see clearly the areas where cases are coming from, and then you can be able to prioritize gender responsive public services in that area that can help to reduce the incidences of violence. So it's a very useful tool. We will continue to use it even beyond COVID because it's something that has helped us to be able to shape our programming around prevention and response on issues of sexual and gender-based violence. Yes.
Thanks, Agnes. I think that's really positive to hear then about something that actually, you know, a positive in all of this, that's something that you can take forward with you as a learning to in the future. And Amy, I might pose a question to you that we got in. Someone asked, has any research been done on the impact of remote learning in comparison to learning in normal settings? So maybe looking at different aspects of such as knowledge change, motivation, emotional status. And I really thought of you because I know with the research partnership that Concern is doing with UCD, a lot of these aspects are kind of measured. So I understand that it's difficult to do research at this time, but if you have any insights for Mandy, who I think asked that question, that would be great.
Yeah, I noticed that one as well, and I'm glad you asked me it. I think, as you mentioned, it's a bit difficult at the moment in terms of being able to access really rich information, particularly directly from children. But specifically in Sierra Leone, with that research partnership we have with UCD, we have done a sub-study of the impacts of COVID within that larger program, where we've been looking at children's access as the first step. And then as the moment that schools reopen and we have access again to the children in a safe way, which we're hoping will be in October, we'll be looking at doing a sort of new baseline essentially, so we can look at where the children were in terms of academic learning, in terms of social emotional learning and well-being and safety. We have the information from just before the schools closed and from following them for the first 2 years of their education process. And then we will have, as soon as they're back at school, that information. So we're looking to make some comparisons at that point. At the moment, globally, there's very little actually available because it is quite challenging to be able to access that information and do it, I suppose, reliably. There's a lot of assumptions being made as to the impacts, but in terms of being able to actually get those impacts. But I think in the coming months, as schools start to reopen and as it becomes more accessible and safe for children to be engaged in these sorts of discussions and sort of research processes, we'll start to see a lot more information coming through.
Okay, thanks so much, Amy. And yeah, I can definitely connect you to Mandy as well on that. We had a question go to Abby that was, could the speakers share their experiences on advocacy, community advocacy in communities on school-related GBV, or maybe especially in poor communities, that Samuel Maku asked, I believe. But I think it might be, I'm conscious of time, so I think it might be nice to kind of conclude on this advocacy note. So whether you're addressing at the community level or a broader advocacy note, it would be great to hear from perhaps all of the speakers in turn around what kind of advocacy you think that we can be doing around the issue of SRGBV at the moment, whether it's the increased protection risks in the home, delayed programs, or programs around gender equality that have halted, and this difficult process of getting back to school and reopening schools. So maybe Tien, will go to you first. What sort of advocacy note would you like to leave with us? Let's see if I think you're on mute, Tien.
Yeah, about the advocacy. So, oh, I already turned it on, right? Okay. You hear me, right?
Yes, we can hear you perfectly.
Okay. Yeah. Like about advocacy, like for Fly International Vietnam, we try to create more kind of like related organization or related group that can understand clearly or understand a specific situation of all the cases that we want to reach. So for example, like for our advocacy, we have youth advisory committee, and for our member on board, we have like a trainee member, and we have 10 members from the big city like Ho Chi Minh City, and Hanoi is the capital and the financial city in Vietnam, and the rest 10 members we from they are really from the ethnic group, the ethnic minorities. So they will understand clearly the situation in their area better than us. Even like, because like, actually, I think like nowadays we just deliver the project or deliver the meaningful things based on our assumption. So that's why like Blind International Vietnam try to make it more effective by really understand in depth with the situation in each area. And because like Blind International also working on the gender equality in the national level, like in Vietnam, but because like we don't have that much resources like human or funds, so that's why like right now we just try to focus on the kind of like the most vulnerable target. And in Vietnam right now, in those areas for gender equality and based on the gender violation in school, we have two big problems. And the first one is early marriage. So it's led to the early pregnancy that Agnes and Amy already shared before. And the second thing is like in Vietnam, we still have kind of like the imbalance between boys and girls. So it's meant like the parents just think that boys should go to school and girls should stay at home and marry and have pregnant and just stay home and do some really homework. Yeah, so we for our youth advisory committee, we also have a lot of experts from UN Women, from a lot of kind of like expertise organization to help us increase our knowledge, our skills, and we are kind of familiar with those children. And it's easier for us to understand and to talk with their languages. Yeah.
Yeah, thank you, Tien, for highlighting kind of the diversity of the members who are of the youth advisory members in Plan, and how important that is in the advocacy work that you do around the country. Thanks so much. And I might now pass over to Agnes if you want to leave us on some concluding notes, what you might like to share with us.
Yes, thank you. I think one of the critical things that we still need to bring in our conversations is the issue around girls who are out of school. Because much as we are talking about school-related GBV, we are seeing that a huge number of girls have never been to school, not stepped school even once, nor are they able to complete even the basic education. So as much as we are talking about how we can make the school environment safer and more productive for children who are already in school, we should be thinking about how the others who are out of school can access education. And it's not just a matter of accessing in terms of just getting into the school system, but the issues around quality education are very key, because we still have places in Kenya where you have a whole school with only 2 trained or 3 trained teachers, and the rest are employed by communities. So that does not guarantee any quality education. We still have issues around gender stereotypes being taken forth, because these teachers have not been prepared enough to be able to meet the needs of the learners, not just education-wise, but also related to issues of violence. So I think it's critical to still have conversations around access to education and how education, the quality of education can be increased, and how services can be provided within the schools. Because when we look at a service like menstrual health and hygiene, it's very, very critical. We see schools talking about, let's have toilets for girls and boys, and that's it. Then we say we have addressed the issues. Yet, it's not adequate. You can't just have a standard toilet for girls when they have needs, menstrual related needs. So we should be able to say, how can we be able to make toilets and bathrooms that support girls during their menses and keep them in school? So it's just being able to holistically look at the issues that affect children in education, and then being able to program around these issues, with the priority being child-centered, and for us, we would say girl-centered. So we think from the perspective of the girl, and we enable and open up the spaces for them to be able to thrive. So thank you. I think that is what I would say at this point in time. Thank you.
Thanks very much, Agnes, for really highlighting the importance of that holistic approach, and that I know, Amy, you were talking about at the beginning of the webinar as well, and that we need to kind of keep a real focus on how everything is interlinked when we have these conversations. So Amy, I'll pass over to you to give your final thoughts perhaps on advocacy, or indeed there's lots of discussion at the moment about building back better, and I'd be very curious to hear what you think about that.
Yeah, I think it's fantastic that we're seeing lots of examples where countries are taking the opportunity to really develop these shiny new policies that are addressing lots of the issues. But a shiny new policy is not going to work unless we're actually looking at transforming some of those negative norms that Tien and Agnes have been talking about there. So I think one of the key things from my perspective and from our perspective in terms of the work that is being done at the moment in the area is that the policies are all great. It's really important that they are there and that they're strong and that they are have systems in place, but unless there is that real transformation and buy-in to address some of these barriers, those policies won't really hold up to much. The issue around the building back better and the building back equal, you know, that still exists there in that concept that it's great to put things in place on paper, but unless we're actually looking at the deeper roots as to why these issues are occurring ever, we're not going to actually be able to use those shiny new policies to build anything back better. There's a lot of discussion at the moment and a lot of work being done at the moment to bring the learning from the development and humanitarian contexts together and make sure that SRGBV isn't seen as just in one of those sectors. And that's, again, really exciting. But having guidelines is only one step, and being able to actually make sure that there are really practical and transformative tools and approaches that people can really hold on to and buy into. We won't see those changes unless we actually get some of that real sort of the meat of it happening. So from an advocacy perspective, I think it's fantastic that we're doing lots of work on policy, but unless we're really having that ownership and buy-in from the transformative sort of way of looking at things, they're going to be very pretty documents on a shelf.
Absolutely. Thanks for kind of ending us on that really clear-eyed look at this, I think, where it's both, there's cause for optimism, but we need to be very realistic as well about the work that we're doing. So I'm conscious of time that we're 6 minutes over. Thank you everyone who's been able to stay connected. I would like to thank everyone for tuning in for today's discussion, and also a very big thank you for the panelists for joining today, Tien, Agnes and Amy. Thanks so much.